The opposition accuses the government of trying to keep the coming healthcare staffing shortages a secret.
I think if you're trying to hide something, it's probably because you might be ashamed of it. Well, they should be ashamed.
According to the document released to the Canadian press, in 2022, the province needed 6,000 more nurses. That went up the following year and is expected to rise again this year, projected to hit more than 33,000 by 2032. For personal support workers, the document shows an even bigger shortage, projected to be more than 37,000 this year, almost 49,000 in 2027, then more than 50,000 in 2032.
It's alarming. We've been ringing the alarm bells for years. So it's not a surprise, but very disappointing that the government deliberately instructed them not to release those numbers. Shame on them for trying to keep this a secret from the public.
She says their numbers suggest the situation could be even worse, saying 45% of PSWs leave the profession in the first year. Another similar Freedom of Information request had already been made previously by Global News and denied. The government argued the information would harm the province's financial and economic interests, leading to unions using the numbers to argue for higher wages. The group Democracy Watch is uncomfortable with the government's argument.
That is just a gigantic loophole that could be abused again and again in many different situations.
All the opposition parties say people need more transparency from the government.
Apart from attrition being a major factor, this government is shrouding everything in secrecy.
The Minister of Health needs to stand up, do her job, be honest and transparent with people about the shortages the systems face, and put forward a plan to deal with it.
A spokesperson for the health minister says the province recognizes more needs to be done to attract and retain workers and is working on that. She points to an item from this year's budget with more than $700 million for enrollment and retention programs. Lorenda, Reddekopp, CBC News, Toronto.